where data on population plays a critical role in the effective planning and development of every nation. However, its availability alone does not necessarily guarantee effective planning unless it is properly analyzed and integrated into national development planning for informed decisions on policy making. To enable the media to interpret information on population correctly, the Ghana Statistical Service, in collaboration with the UNFPA, has been training selected journalists in the northern part of Ghana on population issues. Our Upper West Regional Correspondent, Swala Abdul-wahab, is taking part in the training in Tamale and joins us now. Hello, Swala. Hello, Swala. What have you been learning so far from this workshop?
Thank you for having me. Indeed, I should say the training is very crucial for me as a journalist, because we need able to do stories effectively. And one of the ways to get the information is to access them from those who have them. And you are aware that the Ghana Statistical Service is one of the mandated bodies in Ghana to produce data and other sources of information for use for the development of the country. But from this workshop, I'm getting to understand that we are seriously underutilizing the information or data that is being provided by the Ghana Statistical Service. Most often what we do is to follow their activity, particularly national housing and population. But after such programs, we go back, we don't go to what exactly that the data contain. Okay. So we are indeed learning a lot from this particular training, and we are hoping that after this training, the way we approach our reportings when it comes to issue of population will change positively. But I would like to engage some of the resource persons who have been taking us through some of the work of the Ghana Statistical Service and the UNFPA. We have here a development analyst of the UNFPA, Mr. Mukhtar Guru, to tell us a bit more about the work of UNFPA. Thanks for joining us live on real time on GBC News.
Okay, thank you so much for the opportunity. The name is Mukhtar Guru.
Mukhtar Guru.
Yes.
Thanks for the correction.
Yes.
So who are you, sir?
I'm the program analyst for population and development, UNFPA.
Why is the UNFPA concerned about issues of population in Ghana?
Issues of population is very key to the development of every country, and is the most important human resource for every country. And that is why UNFPA is particularly interested in that. You can't have any meaningful national development without population being at the center of every issue. UNFPA is working with government to support government to produce data to be able to understand the characteristics of the population, and also to be used to inform the development planning. And it's one of the reasons why we are working with Ghana Statistical Service, and also to support the training for journalists, first of all, to understand the data, to understand the population issues, and to understand the need for integration population issue in development planning. Oftentimes, the data is there, but we don't see policy makers, we don't see stakeholders use the data. And therefore, we often plan without using the data. And that is why Ghana, we are struggling with our development issues.
Issues of population is very broad. What specific issues are you much interested in this regard?
We are interested in the population of young people. We're interested in the population of women. We're interested in the welfare of women and girls, particularly the most vulnerable. So if you take the population, it's characterized into age, into sex, and then within the age, you have the age brackets. So the most vulnerable are the young people. And you will notice that in Ghana, we have what you call youth board. The GSS has been explaining to you what is youth board. And that is accounting for a large number of proportion of young people in the country. And that is why we are seeing a lot of young people without jobs, unemployment. It's because population, the planning officers, nationally have not been taking into consideration the population projection. That will give us an idea how much resources we need to plan for the upcoming young people. And we see people graduating from school, no work. We see a lot of young people without work. It's because we have not planned for them. The reproductive health needs of these young people is very important. For instance, there's issue of the central part for girls. Long since we should have known that by this time we have large number of girls, and due to the economic situation, they are not able to procure the sanitary pad, and it's having a total effect on them. Some of them drop out of school because of that. So these are some of the issues that we are very much interested, particularly supporting Ghana Statistical Service to produce the data that can be used for planning. And that's why we're urging policymakers, please, the data is there. Let's focus our planning, let's center our plan on the data. That is the surest way of securing the future for us.
You've mentioned issue of sanitary plan, but I understand that you have interest in family planning issues. Why is it relevant to the UNFPA?
Family planning is very key. In everything you do, you need to plan. And the most basic planning is from the family. You need to plan to stay looking at your situation. First of all, whether you should give birth, and if you give, how many should you give birth, depending on economic situation, and then the frequency, and then the spacing. When you do family planning, it's help you to have quality family. It will help you to have quality health. Because when women space their birth, they are more healthy, the children are more healthy, and you end up bringing up family that you can cater for. When collectively we all do that, we have quality population, and the population will be very productive. And most of this struggle that the government have, the families have, will not be experiencing them. So family planning is very, very, very key.
You also mentioned the aged. They are old. Why should you be concerned about them?
We should concern about them because after retirement, they are no longer earning income, and they need to be taken care of. We have the social welfare system that is not very adequate to take care of them. Our SNIT, how adequate is the SNIT? Those who retire, how comfortable are they? So we need to also plan for them. It's all because of planning. When we know that this is a workforce working, and in 5 years' time, 10 years' time, proportion of this welfare are retiring, government will need to plan for their social welfare. Their needs, the aged have special needs, we need to plan for them. And that is why there is a need for centering every planning on population.
So, looking from the discussions we have had, how will you describe Ghana's approach to issue of these family planning issues? Is this something that you are making a headway, or there is a challenge?
I would say we are making progress, but the progress is slow. Looking at the targets we have, you notice that yesterday there was a release on the key indicator for 2022 demographic and health survey. And when you look at the indicators, they are not very encouraging. Looking at the efforts we have put in working towards those indicators. For instance, the TFR, total fertility rate, we're expecting to have gone down low. It's 3.9, from 4.2 to 3.9 since 2014. So the difference is not that much. So we need to do a lot. We need to find out what is the causes that is struggling the progress. Is it cultural? Is it information? Is it education? What is it? So we need to get evidence on what the challenges are so that we tackle them from those challenges. So we still need to do a lot of campaign, a lot of awareness about importance of family planning.
And who are to do this awareness and the advocacy?
This question you're asking me, you are the first people to lead in doing this awareness. And one of the reasons why we are doing this training, for you to understand the issues, so that when you are doing the advocacy for Ghana, not for us. We are doing advocacy for Ghana. You do with evidence. You do with facts. Once you do evidence with facts, people will understand you, they will appreciate you, and they will buy into it. So the advocacy is everybody's role, but we expect the media to take the leadership. Take it to the policymakers. Let them understand the importance of these issues, and then we'll all be on the right path.
So you've been listening to Mr. Mutaru Goro. He's a development analyst. Am I correct? Population analyst working with the UNFPA, which is partnering with the Ghana Statistical Service to organize this 3-day training for selected media practitioners and journalists from Upper East, Upper West, Northern Region, and Bono East Region. We are quite a number of sizable here, and we are going through a lot of things, particularly regarding the work that the Ghana Statistical Service has been doing in the past years, and how effectively have these works been used by the media to ensure, effective development of the country. We are going to engage the regional statistician of Northern Region, Mr. George Agbano, to throw more light on some of the works that the Ghana Statistical Service has been doing regarding their research work. Thanks for joining us live or real time on GBC News.
Thank you for inviting me.
Yeah, so tell us, you have been producing data and other works. How relevant are these to the development of the country?
Yeah, Ghana Statistical Service is an institution that is mandated by law to produce data for planning. As we all know, we all need data to plan. Even at the nuclear family level, we need data to plan. So at the national, regional level, we all need data. The Statistical Service is an institution that is mandated by law to provide all this data for planning. We are mandated to produce a CPI, which we use to calculate the inflation.
What is CPI?
Consumer Price Index, then the Producer Price Index, all to check how prices on the market are rising. We are also responsible for conducting health surveys, living standard surveys, and we are also mandated to conduct population census every 10 years, just to mention few.
So after you have conducted these researches, what do you do with it?
After the conducting of these researches, we disseminate information. Thus, we go around, disseminate the information, or bring out the findings to the policymaker and the general public. And we have a website where we post all these findings for the view of the general public. Whoever needs it can either go to our website, download it, and use it. It's free because it's being financed by the state.
The media have been using some of the information that you put on your websites and other places, and yet you still find it necessary to organize training for the media. What has triggered this?
Yes, we realized over the ages that the media is an organization or institution that stands between the policymaker and the public. So we find it necessary to reach out to them, for them to help us disseminate this information or to carry out the findings of our outputs. So that's the essence of this workshop.
Yes, so we have been doing that for quite some time now, but from the interaction that we have had with you, you appear to, or it appears media are not doing enough in using the information that you provide. What exactly do you expect from the media?
Yeah, we expect media. For instance, we have done our latest population and housing census in 2021. The census is done every 10 years. So when it's done like this, we look at how the structures of our population has changed. How many numbers have been added? How are those numbers distributed around the age group? How many are women? How many are female? And where are they? So all these informations require the policymakers, decision-makers to plan. Because hitherto the population we know is X, but now it is Y. How many people have been added? And which age categories are they? How many women has entered into reproductive age group? That's 15 to 49 years. What are the implications? Are the policymakers to have this data for planning because they have additional numbers to plan for? That is the essence of organizing this workshop, to educate the media on these outcomes, and then for the media to understand this issue so that when they are reporting, they can report it correctly. And then some of our reports are published. Media always go for these reports, and sometimes, if you are not careful, you misinterpret some of the findings. So that is why we organize this, so that we take them through how these indicators are calculated, how they are to be interpreted, so that when they are reporting, they can report correctly.
Yeah, you give some examples as to how the media can improve on some of its reportage. Can you reiterate some of them, if you can remember?
Yes. We realized that when we publish some of our findings, a lot of things go into the computation of it. Sometimes the media pick only the data and publish it, but because they don't understand what goes into it, they just publish it wrongly. That's why we've taken the trouble to take them through, one, the population. They have to understand the population as a whole, how the population increase, where are they are the bulge, and then when they see the figure, they should pay attention to details. Some of the figures have age category, that's 15 to 35. But if you are not pay attention to those details, you just take the picture and just flash it as if it's pertained to the entire population. So those are our concerns and the reason why we are engaging the media to understand these issues, so that when they are reporting, they report it as it is.
So what do you expect of the media after this training?
After this training, we expect the media to understand the population dynamics. Population changes over time. When you are reporting on the population, you first have to understand what constitute or what are the factors that leads to that population increase. What are the factors that contributed to where we find the bulk of the population? Once you understand this, your reporting on population issues will change. And then some of the report, when you take it and you are reporting on it, you understand some of the indicators and how to report on it, so that your headline will not be misleading to the public. Those are some of the essence why this workshop is very necessary for the media.
Right. So you've been listening to Mr. George Agbanyo. He is the Northern Regional Statistician, who is one of the resource persons taking media practitioners and journalists through population management or population issues in the Northern Regional Capital, Tamale. We have here one of the participants. He is Mohammed Gaddafi. He is here to share his views on what he has learned so far regarding the training. Mr. Gaddafi, thanks for your time on Real Time on GBC News.
Thank you very much.
Yeah, so today is the second day.
Yes.
How will you describe the training?
Well, thank you very much for this opportunity. I think we are ending tomorrow, but today, just like you mentioned, is the second day of the training. And I must say that it has been very insightful and very educative. because looking at all that we have been taken through since yesterday when the training commenced, I think there are a lot that personally I have learned, because moving to this training, these were issues that I was never well aware of. I was not very educated about them or informed about them. And this has actually come to open up my insight about population communication and all that has to do with data interpretation as far as reporting on census and population issues are concerned. So by and large, I must say that this is a great opportunity that the UNFPP and the Ghana Statistical Service have actually organized for us.
So what do you intend doing after this training?
Well, one thing that I know certainly that would improve in me is my ability to interpret data, because in our line of reportage, we normally come across information that contain data, and as to how we go about reporting it also dwells so much on our understanding of the data that we have access to. And just like yesterday, that the Ghana Statistical Service encouraged us to frequently visit their website to have access to information pertaining to all the surveys that they have conducted over the years, and even current surveys that they have conducted, particularly yesterday when they released the health demographic survey report. This contains data pertaining to all the issues they have been able to gather from across the country. So in reporting on them, you also need to have a full appreciation and understanding of this data and figures that they are putting out there. So one thing I know that will change in me henceforth or moving forward is that I now appreciate how to interpret this information and also go about it, because yesterday, one of the concerns raised during the training was also about the fact that over the years we have misinterpreted some of the data that they put out, and by so doing, we misinform or mislead our readers, our viewers, our listeners. So I know that myself and most of our colleagues who have been part of this training would improve going forward.
Thank you very much. Mr. Mohammed Gaddafi is a journalist working in the northern region here. The expectations are high regarding the outcome of this training. Through our interactions with the resource persons, we realize that indeed the media are utilizing the information that the Ghana Statistical Service is producing. For instance, looking at issues of sanitary pads, births and deaths, the aged, obsessive fistula, a whole lot. And we believed that at the end of this training, the way we report on some of the works of the Ghana Statistical Service will improve positively, so that the policymakers, through our reportage, can take decisions that will inure to the benefit of the people of Ghana. Back to you in the studio.
Thank you so much, Swala Abdul-wahab, for those updates. Indeed, there is no end to population issues and dynamics, because they are overwhelming and keep changing with time. We are so grateful for your time, and we hope henceforth you would report accurately on population issues. From